Hey, it's Dr. Lacy. Um, and I wanted to start today to talk about sort of my philosophy about aesthetic treatment because we're introducing several new products and we're going to tell you all about them. And so I think before I even go there, I think I'd like to kind of explain the way I see this sort of industry and my role in it, because it is a little bit tricky. There are so many different treatments and products and options, and people will tell you so many different things that it can be hard to kind of separate what's good, what's not, what's real, what's not. And also trends are changing, which is really kind of interesting, that there are sort of fads and things that change. And so I come at it from very much a science background. I'm a biology major originally, and of course, as you know, going through medical school and residency and been in practice for a long time, I look at I try and look at really things that have some evidence and are based in sort of scientific facts. And I think that's important because I want to offer things that I think have real value to patients and have real benefit. And so when we look in the world of aesthetics, there sort of are, I would classify, I mean, there are a lot of different things, but there's sort of two kind of groups, I would say. One is treatments that are going to help you, look better and address a problem, but they're really not going to do anything to improve, say, the skin quality or texture or tone. And that would be things like neuromodulators, the Botox-like products. There's nothing wrong with those. They do a lot of great work, and in certain settings, particularly used for things like migraine and TMJ and other things, they are dealing with an underlying medical problem. But when you're using it for muscle relaxation and wrinkle treatment, it really is sort of addressing that issue, and those results have a time limit, and then you're going to have to do it again, which is fine, and they're great products. But that's sort of one classification. The other thing I would say is hyaluronic acid traditional fillers. Again, great products, really important role, but they're not really doing anything to recondition or regenerate your skin. And so the other area, the other side, would be things that are actually going to do something to treat or improve your skin quality. All of the laser and laser derivative products, lasers, pulse light products. We have Opus Plasma, which uses plasma energy to regenerate your skin. And what those are going to do is cause controlled damage, which is going to allow your skin to heal back better, heal back with collagen production, and heal back in a way that improves the skin quality and improves the appearance. And so that's sort of one group. And then in the other area, something that is really taking off, which is sort of regenerative treatments that use exosomes, which are, they can be animal or plant-based molecules to stimulate cell improvement, cell growth, cell repair, blood vessels development, and then also to take your own plasma, platelet-rich plasma, and re-inject it to, again, stimulate collagen production, elastin production, and improve the quality and texture of your skin. And that to me is really interesting and really fascinating, because I'm all about trying to help people look like the best version of who they are. I think when you try and chase sort of youth, and I say that as somebody who has gotten to the point where you can't do that anymore, when you try and chase something that's unattainable, you often end up with results that look odd or look forced. And so, I really like to help people feel like the best version of themselves. I do that with hormone replacement therapy, and I have videos about that. But the idea behind a regenerative approach is to say, well, how can I help somebody feel like the best version of themselves right now? How can I help somebody get to the point where when they show up at work, their coworkers go, oh my gosh, you look amazing. Did you have a great night's sleep? Or, have you been eating better? Or what are you doing? Your skin looks amazing, right? And it's not always obvious. It's not always, walking in and somebody said, oh, that person definitely has lip filler. That's not to denigrate that. I think that all of these tools have their role. But for me, the thing that I think is most interesting and compelling is the areas in which we can help your own body, and often using your own cells to help improve your skin's appearance and to address some of the issues that you have in a way that is going to help you feel like the best version of yourself. And so as we explore some of these different options, I think it's always good to have that touchstone of what we're doing and where the philosophy is. And, when you're looking for a provider, I think it's really important to look, we always look at things like price, we look at location, those things are all really important, of course. But you also want to look at what's that person's general philosophy and does it fit with you? And there are a lot of different ways that you can approach things. And so you want to find somebody who's going to listen first is really, really important, and also help you find the treatment protocol that is going to best serve your ultimate goals in a way that you're going to be happy with.